Hi, my name is Tammy Snyder. I'm from New York State and I have a 16-year-old with severe autism.
Hi, my name is Grace Juliet. I'm from New York State and I have a 16-year-old brother with autism.
I'm Juliet Snyder and I also have a 16-year-old brother with autism.
Something I would want other people to know about what it's like to be a parent / caregiver to somebody with severe autism. It is very scary most days, and not to mention the lack of resources, the lack of medical providers, the lack of unmet needs that our children face on a daily basis. It's very difficult to get our children into medical providers as it is, to get them out of the house sometimes, let alone finding a medical provider that actually wants to treat our child. Whether maybe you do have a pediatrician that, you know, your children are used to going in and out of their office since they were little, which, God bless ours, we absolutely love our PA. But as far as any specialized care or needed blood work or MRIs or dental work or OR procedures, that is non-existent for my son at the moment, and he struggles and it's affected him in every way possible, which creates a lot of behaviors for us because he is not getting his medical needs met. But I'm going to turn it over to his siblings, and I want them to tell the world what it's like to be a sibling living with severe autism.
I wish more people could, care about, how hard, it is for, a family to have to, deal with someone with severe autism. I don't mean that in a bad way, deal with, because I love my brother, but, they just don't care how much help he really needs. They just give him to my mom and just expect her to figure it all out. But it's if they can't figure it out, how can she? Doesn't make any sense.
Yeah. One thing I don't like is the lack of emergency response for people with autism. If Anthony were ever to have a severe medical problem or a severe meltdown that could, get someone or himself injured, the police do not do anything because they have no idea how to respond to somebody with a disability. Especially people with autism who are nonverbal or, they don't comprehend the things. They try to speak to them, they're just like a friend, but obviously people with severe autism, they don't think that way, so it just ends up making things worse. And they can't, get them anywhere, they can't take them out of the house, they can't transport them, they can't help them.
True story, because we've lived that experience, and we're not saying that our local police department and paramedics didn't try their best, but it's a very traumatic situation for all of us involved, for him, for me, for his sisters. Something nobody should ever have to experience, honestly.
It's a lack of education to the, people who respond to first responders. They don't understand how to deal with those situations. They're not taught how to, so it's not their fault.
Yeah, exactly. I mean, I know our police station does get some sort of autism training, but obviously it's, taking a couple-hour training annually or whatever it is not going to be effective for a life and death crisis situation. One of the biggest changes I would love to see with dealing with people that are impacted with severe autism is basically comes down to financial resources. Giving incentives for medical providers to want to treat these children, to be able to bill at a higher rate or whatever, because we've literally been told that my son's not worth the OR room as far as billing goes because he would take up 4 times the amount of time as a typical child. As far as residential goes, as far as education goes, in New York State, we are no longer a state that can list a one-on-one for an IEP. So our kids that are with significant behaviors are not able to be maintained if they don't have the funding to be able to have that one-on-one in the classroom in the residential setting, or if they need two people to go out in the community or go out on a field trip. So money is definitely a big course of this all, and even as far as respite providers go, some of our kids do need two staff at all times, even in the home. I know if I didn't have my staff that's been with my son for years, and also his cousin, there would never be able to be just one staff in our home, and that's not allowed neither. Like, unless your kid is already placed, then the state has to figure it out, but they make us as parents figure out this situation, not caring how it affects us in any way, if we're able to go to work, if we're able to feed our children. And that's the thing too, like, our property and our homes are destroyed on a daily basis. Nobody covers that. We have to figure that out. We have to keep creating ways to try to prevent, going through a TV every week. Like, yeah, it's a natural consequence. Don't buy a new TV. However, if you ever met a child with severe autism, that doesn't fly. And it's not really fair to not have a TV in your home for the other siblings once they break it. We won't even get started about all the Xboxes that have gone out Gracie's bedroom window here.
I think that, we need to teach it in a teach, just autism as a whole in a different way, because, it's, when people think of autism, they think of, either, someone who's super smart and nerdy, or, that's it. That's it. You don't ever really see someone, talking about severe autism. I know when I, talk to my friends about my brother, they're, for the first time, they're like, what? What? They kind of understand autism, but they don't, really get a grasp of it. And it's because it's such, a big spectrum. We need it, we always hear autism as a spectrum, but you never actually are taught, how big of a spectrum it is. I have two siblings with autism, and they are both on a completely, they are completely different, but they both have autism. I think it would be way better for us to be able to get, resources and stuff like that if it was educated in a way that, made people understand, it's not just neat, nerdy people or super strong people or anything like that.
Superheroes,
yeah,
right?
Right, yeah.
No superheroes in our home.